Do you know feeding your body excess nutrients can be harmful? I am Dr. Anima Sharma from Shalby Hospital, Jaipur. I am here to talk about malnutrition, which includes undernutrition and overnutrition both. Our body needs calorie requirement for functioning of organs properly, and when these are not available properly in right amount, that becomes the malnutrition. It is harmful, and WHO has added obesity, overnutrition recently in malnutrition because it is equally detrimental for the health and society. Causes of malnutrition we can divide in three classes. Number one, there is a difficulty in swallowing, in which comes the neurological condition like dementia, motor neuron disease, paralysis, in which patient is not able to eat properly. Then comes the diseases of the neck, in which there is a affection of the esophagus. So cancer of the neck comes, and any lump or esophageal stenosis like this comes. Then it comes the malabsorption syndrome, in which patient is eating but it is not absorbing and getting to the blood. Nutrients are not available to the body. Celiac disease, there is a diarrhea and malabsorption, and so there is a malnutrition. Another diseases are all the diseases in which recurrent diarrhea is there and proper absorption is not there, like irritable bowel, inflammatory bowel disease, Crohn's disease, ulcerative colitis, and pancreatic insufficiency. All the diseases of pancreas finally causing the pancreatic insufficiency, which causes the malabsorption syndrome. In liver diseases, there is anorexia is present, vomiting is present, and patient absorption is affected. So he is prone of malnutrition. Then comes the hormonal disorders like hyperthyroidism. There is a excess calorie requirement is required because BMI is increased, so they are prone for malnutrition. There is an increased demand of the body like chronic infections, pneumonia, tuberculosis, HIV/AIDS, or multiple admission due to chronic illnesses also causes the malnutrition. Then we come to the overnutrition. Overnutrition, in some hormonal condition, overnutrition can be occur because decreased calorie burn like hypothyroidism and Cushing disease. There can be overnutrition. And some brain tumors, there is a excess appetite is there, so people eat a lot. Whenever a patient comes to our office, we can immediately make out that he has malnutrition. He has a typical appearance. There is a edema around eye and abdomen, and there is a wasting of whole of the body. His skin is pale and yellow, conjunctiva is pale and yellow. His hairs are thin, brittle and brownish greyish color. His nails are also brittle, and there is a weakness, horizontal lines on his nails. His muscle mass reduced, so mid-arch circumference is reduced, and his weight is reduced. BMI is calculated with weight in kilogram divided by height in meters square. So whenever it is less than 18.5, it is mild malnutrition, undernutrition, and when BMI goes more than 25, this is said overnutrition, overweight, and obesity is said when his BMI is increased more than 30. So these are the sign symptoms of malnutrition. Now we come to the when we have to contact the doctor. There is a few warning signs are there for which we have to immediately consult the doctor. Number one, there is a reduction of the weight more than 10% of the total weight in few months. That is the earliest warning sign, and we should be immediately meet to the doctor. Then comes the if a person have fainting episode, weakness, his BP is low, his pulse rate is low, then we should meet. Another thing is there is a difficulty in breathing on exertion, he has lethargy, he is irritable, and his school or office performance is reducing, he is not able to concentrate, then also we have to meet the doctor. Whenever patient comes, by appearance also we can make out he has malnutrition. Then we start measuring his height, weight, mid-arm circumference. BMI we calculate with the help of height and weight. We go for blood tests. We can measure vitamin D level, calcium level, phosphates level, zinc level and magnesium level. These also tell us the micronutrient status of the body. Simultaneously, we assess for the cause of the malnutrition, for which we go for history-wise, which organ is affected, what can be the probable cause. If it is psychological, for counseling is required and assessment of the mental condition. Then we need the basic checkup of the body like chest x-ray, sonography, abdomen, clinical palpation of the body for any lump is there, and this way we go for diagnosis of the malnutrition. For treatment of the malnutrition, first we have to see the cause. So we have to treat and diagnose that cause. Then we come to the treatment part. For that we have to assess grade the malnutrition. If it is mild and moderate, then we can advise them, we can give them diet chart, and according to that they can treat at home. For this, number one, protein should be graduated. What quantity of protein has to be given, and what type of other vitamin supplement has to be given, that depends on his blood test and deficiency of particular micronutrient. Now we come to the severe malnutrition. In severe malnutrition, again there is a difficulty in absorption and decreased appetite, so there is a complicated cycle occurs, and simultaneously they have difficulty in swallowing. So we give him refeeding in the form of well calibrated, graduated, market made diets which is available in the market in the close observation of clinician. And if a person has difficulty in swallowing, then we can put the Ralph's tube, and that is Ralph's tube feeding can occur in the liquid form in the well calibrated diet chart. If a person is not able to absorb the food or have a diarrhea, then in that condition we can give the nutrients in the form of IV fluid also. This is called as total parenteral nutrition, in which we can give all the carbohydrate, protein, minerals and vitamin in the IV fluids. Sometimes few mental disorder also prone for malnutrition because of some psychological problem, in which most common is anorexia nervosa. There is a person have body disfigure syndrome, so they have loss of appetite. For them they need counseling and treatment of anorexia nervosa, and then they tolerate the diet well. Another is bulimia. In same way, there is a counseling is required. Simultaneously, we treat the cause of malnutrition also according to their diagnosis, and this way we can treat the malnutrition very well in under guidance of clinician. To prevent the malnutrition, number one is the education should be perfect. People should know what is the right food for them, then they will choose the right food and avoid malnutrition. This can be done by increasing the awareness for nutrition, quality of food through school and college teaching. Then we can have some discussion on TV, social medias, then printed material in newspaper and other magazines. So the people should know what they should eat and they should avoid. Then we come to the diet portion. For diet, these days people have more choices for the market packaged food. I personally advise that market and packaged food should be avoided as much as possible. Fresh, homemade food is always better. If suppose you are not able to make food at home, then you can choose the food which have less fat content and less salt content, because which is harmful. Then we come to the type of food we should eat. In this, ideally there should be, these days we are living in the era of high carbohydrate diet. I advise the carbohydrate should be reduced to less than 50% and fat should be less than 30% and protein should be increased as much as possible, because protein is the main building block of the body. Then for increase the protein content, we can do is we have to increase the soya bean, which have highest protein content. Then we have to increase all the cereals, and in cereals again we have to change the cereals frequently, like rajma, chola, chana and all these things. Then we have to increase the fresh vegetables and fruits, because they contains vitamins and minerals, which is also necessary for our immunity. If you are non-vegetarian, we should increase the egg is good for your protein content. Then fish is good for omega fatty acid, but we should avoid the red meat and other fried meat and non-vegetarian articles. As we have seen these days, obesity is very common. In young people, it has come to 40%. To reduce the obesity, we have to reduce the fat content and increase the protein content. And for this, another problem is alcohol. Alcohol make prone for you increase the fat content of the diet, and it gives you dry calorie also to the meal. So obesity chances are increases. Same time, I will advise to stop smoking or reduce smoking. It is also detrimental for health. Now, malnutrition is a very small disease, easily treatable and controllable if you know the nutrition and if you have a proper diet.